Mr. Speaker.
I call Kevin Hague.
Thank you, Mr. Speaker. I'd like to begin by thanking you, sir, for accepting this call for an urgent debate. It's hard to imagine a situation more serious than that's unfolding in Havelock North currently, and more deserving of an urgent debate in this House, sir. The Green Party's sympathies and support naturally are extended to those people in Havelock North and the surrounding area who have been affected by this Campylobacter outbreak. The numbers themselves are sobering reading, sir. Already more than 2,000 people ill from what actually is a very serious illness, more than 20 hospitalised, 2 people currently critically ill, and possibly 1 person already dead from the disease. It's a grave situation, sir. It's entirely appropriate that at this point the focus of those on the ground in the Hawke's Bay and in the Ministry of Health should be on ensuring appropriate and speedy treatment for those who've been affected by the outbreak, on ensuring that the water supply is safe, and ensuring that people have access to reliable information and the kind of practical support that they need when they need it, sir. That's appropriate to be the initial focus. I've been impressed in the last day or so from the leadership that I've seen from Lawrence Ewell as the Mayor of Hastings District and Dr Nick Jones, the Medical Officer of Health for the Hawke's Bay, a reliable man. I have not been so impressed by the silence that I've heard from the Minister of Health. This is an issue that, while it is unfolding at a local level, has national repercussions. And I believe that New Zealanders around the country, many of whom rely on water supplies similar to that in Havelock North, are needed to have heard from the Minister before now. I appreciate the comments that Pesita Sam Lotuinga has just made in the House. And perhaps the silence has resulted in, from the Minister himself, Honourable Jonathan Coleman, being away from his post and Sam Lotuinga stepping in to cover the role, and that may well be the case. It is inevitable, sir, that people in Hawke's Bay are going to have some deep and important questions. How did the contamination occur? How was the contamination allowed to occur? In other words, why did the systems designed to keep drinking water safe, how did those systems fail? And could the warning have been sounded earlier? We've heard appropriately from the Honourable Annette King that there was at least a day's delay between a positive sample being found and anyone being told. Did we need to have that day? If we hadn't had that day, could infections have been prevented? At this stage, Mr. Speaker, I want to be very careful not to jump to conclusions about the answers to any of those questions. Some speculation is inevitable, and I'm reading about it in the news media, but the Green Party does not want to go there. But when we do come to investigate those questions, the Green Party will be looking to ensure that the investigation that occurs is as robust and independent as it possibly can be. And rather than an investigation that is commissioned by the Hastings District Council with some support from the Ministry of Health, we would want to see that investigation being led nationally and being properly independent. We would want to see the involvement of appropriate experts, such as Professor Michael Baker, such as Professor Nigel French. And we want to ensure, and this is one of the reasons why we would want such an investigation to be national in its focus and scope, that whatever is learned about what has gone wrong and about improving water safety in Havelock North is applied not only in Hawke's Bay but around the country, sir. The Honourable Annette King has drawn attention to the sanitary works subsidy scheme having its funding cut by this government. Mr. Speaker, that is an issue that I know has affected many rural communities around the country. We do not say that that has played a role in this particular disaster, but Mr. Speaker, it is an issue that we would want to see canvassed in such an inquiry. Mr. Speaker, we note that with climate change and its growing impacts, we are likely to be seeing an increase in the frequency of heavy rain events, an increase in the frequency of severe flooding events, and with those, sir, we're likely to see an increase in outbreaks of waterborne illness around the country. It is essential, therefore, that as a parliament and as a nation, we do what we can to ensure that the systems that are designed to keep our drinking water safe are robust and reliable and up to that challenge. Mr. Speaker, the name John Snow is one that probably different groups of people will recognise for different reasons. Some will think immediately of Game of Thrones. Others will think of the prestigious newscaster. In my interest in life, I immediately think, of course, of John Snow, the fantastic England fast bowler of the 1960s. But epidemiologists and all of those who have studied public health will think back to their very first lecture in epidemiology. Because in 1854, John Snow, a physician in London, mapped an outbreak of cholera, and by doing so was able to trace the source of that outbreak to a public water pump in Broad Street in what is now Soho in London. And while what happened next is somewhat apocryphal, having traced the outbreak to that water pump and receiving no response from the proper authorities to his having done so, Dr. Snow went and removed the handle from the Broad Street pump, thereby preventing the further spread of cholera in Soho in London. And Mr. Speaker, drinking water is so ubiquitous in our lives that we perhaps become blasé about its importance, about its preciousness, about the impact on our communities when things go wrong. But following the inquiry into what has gone wrong in Havelock North, I expect this government to take the action that is equivalent to John Snow and the handle of the Broad Street pump, and to act decisively to ensure that this kind of outbreak cannot happen again in New Zealand. Thank you, sir.
Barbara Stewart.
Thank you, Mr. Speaker.